We originally transferred to the University of Missouri from a college out of state. And at that point, Katherine already had some therapy that she was receiving, and we were trying to look for where would she sort of land once we transferred to Mizzou. We met Connie Blow. She got us in touch with occupational therapy, with speech preschool, and so Katherine's just sort of gotten all of these therapies since the beginning of some of these programs, so she's been here ever since.
Katherine joined our preschool this semester, and she has significant delays. I wanted to make sure she was safe in the preschool and that my clinicians were learning solid ways to help a child that had physical needs navigate their environment.
She has cerebral palsy, she has autism, she is a stroke survivor, she is legally blind, so she's kind of got a lot working against her. But when we come here, we're able to address a lot of the common problems with all of those different disabilities all in one place.
So as a physical therapy student, we have a program called Mizzou. Some of the patients we treat are pediatric patients, and Katherine is one of these patients. So we would go down there about once a week on Thursdays and go and hang out with her and work on different activities to help her while she's during class, to make her more involved with her classmates and get the full experience of preschool that she may not otherwise have.
Katherine, this semester we've been working a lot on feeding and drinking out of a sippy cup and some hand washing. And so those are kind of things that she has trouble with and that her mom thought would be important.
Since OT focuses on function, these are important daily living skills that she needs to be able to function in to be successful. But as she gets older, it's going to be important that she's independent in these skills.
Katherine in the early years needed physical therapy and occupational therapy most definitely, and that was such a need for her that they sort of put communication on a back burner. And just recently she started talking a little bit, and her mom felt like it was a good time to add some additional language and speech intervention for her.
For Katherine, we would have about 7 goals that we would objectives that we would target each session. So throughout the session I would use toys, different activities to try to elicit those communication behaviors from her.
When we started coming here for treatment, it was just clear that we just needed to stick around here. We could address more problems simultaneously here than we could anywhere else, really.
That's the nice thing about the language preschool, is that it's sort of a symbiotic relationships where our college students are learning from their clients and their clients are learning from the college students.
We had been told at birth that she likely wouldn't be able to do much. And when we arrived here, it seemed as though that was probably going to be true. But almost immediately after enrolling in the treatment here, we began noticing really big differences. And so now Katherine is 5, and we would have never expected this, but Katherine is very close to walking independently. Katherine has somewhere between 50 and 100 words and a couple dozen phrases. These aren't things that we ever thought would be possible when she was first born, and all of this sort of information was coming in about what her abilities might be. Well, coming to Mizzou kind of changed our expectations for her, and now we're thinking, well, what's it gonna be like when Katherine can walk? What's it gonna be like when Katherine can have a conversation with us? 5 years ago, we would have never asked those questions because we just didn't have those expectations. But now, after receiving such significant therapy and help for Katherine at MU, we're able to have those expectations that we never really thought were possible.